Today is Monday, November 16th. I've got on my blue shirt and my orange tie, or as orange of a tie as I possibly could have, because today is the Monday Night Football for the Chicago Bears and the Minnesota Vikings. And so I've got on Bear colors. So for those of you who are Bear fans, go Bears. And for those of you who are Minnesota Viking fans, I hope your team represents themselves well tonight. In any case, let's talk about today's topic. Today's topic will be very specific to those of you who are 65 years and up and are on Medicare. I've received phone calls the last couple of weeks, I don't know, 30 or 40, talking to me or complaining to me about DuPage Medical Group and that they are going to lose their physicians if they don't enroll in a specific plan. Well, I've received a copy of that letter right here. It's actually 3 pages, 1, 2, and 3. On page 1, let's take a look at that. I've got to put on the old cheaters because my eyes are 62-year-old eyes and not 16-year-old eyes. All right, and it's a fax copy, so it's not the greatest one. But it says here, in reference to Medicare Advantage plans, in fact, in our quest to improve overall health care of our patients, good idea, through the kinds of comprehensive care promoted by these types of plans, Medicare Advantage plans, I will soon serve as a primary care physician for patients enrolling in those Medicare Advantage plans. Well, good. I'm glad the doctors are going to enroll into some of these plans. My problem has always been I haven't had enough doctors in these plans. Now, this is the part that I take exception to. It will certainly take more of my time to care for and comprehensively monitor the health of my patients enrolled in these plans. You mean you haven't been doing that already? Okay. Effective January 1, 2021, I will only continue to serve as primary care physicians to those patients covered age 65 enrolled in one of the Medicare plans listed below. All right, you have to enroll in an Aetna, a Blue Cross Blue Shield, Humana, and United Healthcare or AARP. I represent 3 of the 4 companies here. The strong arm tactics that I talk about is on the second page where it wants cheaters. Once again, it says, in summary, I am doing this because I firmly believe it is in the best interest of my patients. It shouldn't be a health care plan like a Medicare Advantage plan, which actually has limiting coverages for you to provide the best care to your patients. The letter goes on to say, many of the plans are the highest rated plans available. That's very true. And offer a wide range of supplemental benefits. That also can be very true. However, by supplemental benefits, they're referring to things like dental insurance. And most plans offer a preventative dental plan with a $500 or $1,000 a year dental benefit. There's a disenrollment period between January 1 and March 31st where you can disenroll from this plan. The problem with that is if you lose your Medicare supplement for this plan and you want to go back, you're going to go through medical underwriting all over again. The insurance company at that point has the right of refusal. It's not specified clearly here. It does give you an out, but it doesn't specify the consequences of making that decision. The last part is, what if I don't enroll? If you don't enroll, well, then they're telling you you can't see that doctor with DuPage Medical Group. So, if you trust your doctor, you're kind of being strong-armed into a Medicare Advantage plan. They're not telling you that you can have out-of-pockets on these plans with some companies as high as this year for 2020, as high as $6,700. Another thing they're not telling you is that, and I've talked to a couple of doctors, that their reimbursement schedule can be as high as 20% more than what they would receive otherwise from Medicare or your Medicare supplement. Income for the doctor is fine. I don't care. They can make as much money as they want. That's their business. But they shouldn't do it at your expense. And that's the problem I have with the Medicare Advantage plans. The problem is that the out-of-pockets are too high, and all they're looking at is the specific copay, which in many, many cases can be zero to you for their services. But what about the other services that are provided? Those other services can be as much as $395 a day for each day in the hospital, up to 5 days or 6 days, depending on the plan. But what if you go back in again This is how you can get to this major out-of-pocket as high as $6,700 this year with certain carriers, of which is on that list. Now, Mark, why are you ranting and raving about this? Well, like I say, it is a legitimate product. It is out there. Why I'm ranting and raving about it is the out-of-pocket and the limited availability of the network. If you want it, your doctor's in the network, your hospital's in the network, fine. But they don't transfer very well. If you want to go vacation, if you're a snowbird, don't do this if you're a snowbird. If you want to go on vacation, it's going to cover you for emergency care. Do not worry about that. But if you're a snowbird, well, you want to go for 2 or 3 months elsewhere, now you have to change the plan or notify the plan that you've gone. And these Medicare Advantage plans are not comprehensive nationwide. I don't care what the letter says. Look on your enrollment guide. It will give you the states and the counties that these plans are available in. So if you want to go to certain states, there may only be 2 counties in the states. On the other hand, if you want to go to another state, you might have all the counties available in the state. This is one reason why I'm concerned about these plans. The other reason is if you're on a Medicare supplement, the Medicare supplements are fully comprehensive. That means they are so large of a network in so many states they don't even publish the network of doctors. If you've taken out a Medicare Plan G, you're only out of pocket, with the exception of prescriptions, should be the $198 a year deductible. So they're switching you from a plan that has a $198 a year deductible. Now, granted, you are paying a premium. Remember a few weeks ago I did the FRAM, pay me now or pay me later? Well, this is the case. With the Medicare supplements, you're paying that premium with just a $198 a year deductible, and you have comprehensive coverage. You don't have to really worry about the other expenses like you do with these Medicare supplements. 2 weeks ago today, a gentleman comes into my office. Oh, do I have to pay this bill? It was $27,000. And I looked at it, and I looked at his ID card, and I'm like, well, your ID card with this plan says this. Is this your primary care doctor? I don't know who that is. That's not my doctor. Okay. So my question is, why did you enroll in the plan? Well, my friend said it was a good plan. So when I saw the TV commercial, I called the 800 number and I enrolled. Well, they enrolled him, or most likely they told him that this would be his doctor, and he didn't pay attention to it because it wasn't his doctor. Now, this year he has medical claims. He's out of network, $27,000. That provider provided the services. That provider deserves to be paid. Last week, I had another guy. He called me up on the internet. He went into the hospital. He spent 60 days in the hospital. He was out of network, and he owes $150,000. It wasn't emergency care. You have to stay in network, even the ones with the PPO. If you come in, if you call me up on these Medicare Advantage plans, I will see to it that your provider is in the network. Now, like I say, I have no problem with these doctors saying, I accept the Medicare Advantage plan. Good for them. They're business people. They can do what they want. I've talked to several agents like me. When I first came up, they were like, no, that can't be. And I even called one of the insurance companies. I talked to the home office, and they said, no, that's not right. But they referred me to the local territorial gentleman who runs this. He says to me, Mark, it's good for me because beneath me, we're selling more Medicare Advantage plans. But he also conceded, I want to do it the right way, and I don't like doctors strong-arming their patients to buy these plans. And that's about the way I feel. If you want a Medicare Advantage plan and it's the right thing for you, I'm happy to enroll you in it. Those Medicare supplements are great policies, but as I've said, if you disenroll from a Medicare supplement policy, most insurance companies that I know of, with the exception of one, are not guaranteed issue if you want to re-enroll. They will ask you the medical questions, and if your health has deteriorated, you may not be able to get into those plans that actually provide you greater security. You have to pay a premium. You'll know what that premium is up front, but you don't have that major out-of-pocket. And once again, any doctor who tells you that they can provide better care because you're on a Medicare Advantage plan, I think that's wrong. That doctor should be avoided. Like Paul Harvey would say, now maybe you know the rest of the story.